the Surgeon General. The PHR Meet the Author webinar series is presented to stimulate discussion around current topics in public health. Today's Public Health Reports webinar discusses characterizing the growth of the undergraduate public health major from 1992 to 2012. According to a recent study by the Beaumont Foundation and the Association of Schools and Programs of Public Health is one of the fastest growing undergraduate majors in the United States, with the number of majors increasing 750% over the last 20 years. The webinar today will feature authors of the study presenting data from the National Center for Education Statistics that documents the growth of and examines the demographic trends within this growing population. The latest data will be available today, and the results raise many questions about the impact these students have after graduation. On behalf of the U.S. Surgeon General, Vice Admiral Vivek Murthy, and the Public Health Reports Editor-in-Chief, Dr. Frederick Shaw, I want to thank Dr. Craig Blakely, the Dean of the School of Public Health and Information Services at the University of Louisville, Dr. Jonathon P. Leider, Research and Evaluation Consultant at the Beaumont Foundation, and Ms. Christine Pleppies, the Director of Data and Analytics at the Association and Schools of Programs of Public Health, for joining us today. This and all PHR webinars are archived on the PHR website for future viewing, and a question and answer session will follow today's presentation. To submit a question for after the presentation, type your question into the chat and question box, which is opened by clicking the two small white arrows that are in the upper right-hand corner of your screen. If you are interested in seeking 1 credit for certification in public health continuing education practice instruction, you will be given a password at the conclusion of this webcast. And now it is my pleasure to introduce Dr. Craig Blakely, Dean of the School of Public Health and Information Services at the University of Louisville. Let us begin our presentation. Dr. Blakely?
Thank you, Erin. So let me make one quick point. Due to schedule conflicts, we've got our State of the University address in about 45 minutes, so I will be missing from the questions at the end, but you can reach me if you need to offline, and my two colleagues are more than well prepared to handle any questions you might have directed my way. Next slide, please. So what I wanted to do is provide a bit of an introduction and talk about well, so first an overview. I'll provide some frame for introduction. It'll be relatively short because I'm sure everyone that's on listening to this and read the piece is pretty well tuned into what undergraduate public health is all about and is very interested in the data that we'll share in just a minute. JP Leider will then talk about the methodology that we used in pulling this all together, and then Christine Pleppies will provide a summary of or overview of the findings, and then there'll be a little section of discussion and comments, and then we'll look forward to questions and answers, giving my caveat a moment ago. Next slide, please. So by way of short introduction, we're all quite familiar with the fact that the academic public health emerged from medicine in the early 1900s. 1915 is what most people point to. Well, it's really debatable where applied public health started. That's pretty clear, and the first formal school, of course, started at Johns Hopkins with Rockefeller contribution shortly thereafter. And so it's not surprising then that historically the students that originally moved into public health were themselves coming out of medicine, typically physicians. Therefore, the discipline emerged, unlike many others, as a graduate instructional set of programs only for a long period of time. It's only been in the last 20 years or so that there's really been a real upswing in undergraduate education, and that's really taken off in the last decade or so, which kind of fits with the focus that we've taken with this paper. And so what we wanted to do was look at the available data on undergraduate publication. ASPPH has some wonderful data on graduate education, but only recently has started to look at undergraduate data. So as JP will talk about, we looked at the NCES data set to try and get a handle on what's really going on with undergraduate education. And so that's the platform by which we began this exploration, and we'll tell you a little bit about in the coming minutes. Next slide, please. So now let me just introduce JP Leider, who will talk to you about the methodology that we've used, and we'll move forward from there. Thank you very much.
All right. Thanks, Craig. Next slide, please. So as Craig mentioned, folks at the Beaumont Foundation and ASPPH became very interested in getting some sense nationally of just how many undergraduates were getting degrees each year in public health. We've all heard anecdotes for years of new programs and explosive growth, but we lacked even a ballpark estimate of just how many degrees were awarded in recent years at the undergraduate level. But fortunately, the National Center for Education Statistics collects degree completion data from basically every college or university in the nation. If you're a college and university and you want to receive federal financial aid, the federal government requires that you submit a lot of different kinds of information to them each year, one of which is degree completion data. So NCES's Integrated Post-Secondary Education Data System, or IPEDS, has published these kind of data every year for the past several decades. NCES also tracks costs, student body characteristics, statistics on faculty, and more. And for those of you who are interested in learning more about IPEDS and how we did this, I'd actually recommend that you read the New York Times piece on their Upshot blog from Sunday on the new college scorecards. So those college scorecards put out by NCES use a lot of the data, underlying data that we used here, but in very different ways. So what we did is we took data from all of the available years, starting in 1980 and then 84 through 2012, and converted it to 2012 IPED standards in terms of the classification of instructional program codes, which lets you look at each program year to year and compare that over time. We noticed when looking at the older data from the 80s especially that the quality of those data were poor, and so especially for public health, and so we decided to exclude those from our analyses and really look at 1992 through 2012 data. So one other thing to mention is that IPEDS does have a family of codes for public health, but we brought in others too that are kind of placed elsewhere, even though they're very core to public health, like epidemiology, health policy analysis, and biostatistics. Next slide, please. So the final thing that I'll mention by way of methodology in terms of cleaning and combining and looking at all these data, one of the last things that we did for purposes of this presentation was convert the NCES codes to the ASPPH codes by way of a crosswalk. And the idea here is that we can get a kind of better sense at a broader level of these codes, looking within public health and how many folks are coming out in each of these specific program areas. And you can see that here, the crosswalk. So next slide, please. So Christine, will you take over?
Great. Thank you, JP. Next slide, please. So we don't want to make you wait until the end of the presentation to give you the latest and greatest data. The National Center for Education Statistics just recently released their 2014 data a few weeks ago, and thank you to JP for tackling that data set to get us this number. So as you see, the trend continues upward with the 2014 data showing 9,629 graduates according to our methodology. The number of institutions also continues upward, somewhere around 200 now. So we haven't finalized that data, but we will let you know at the end of this presentation where you can go to interact with this latest data available now on the ASPPH website. The rest of these slides, though we present the 2014 data here, will only go through 2012 as was reported in our article. Next slide, please. So this slide shows the number of undergraduate public health degrees awarded from 1992 to 2012, and it shows it by the ASPPH program area that we crosswalked with the NCES data. You can see the areas of study listed below. Overall, nearly 50,000 degrees have been awarded, baccalaureate degrees in public health, and half of these have occurred after 2008. The upward trend, as shown here, started in 2004. From 1992 to 2004, there was an increase of 700 graduates, and from 2004 to 2012, the increase was about 5,000 graduates. The most common program areas are health education, behavioral sciences, shown for 27% in 2012, and that's the dark blue bar at the bottom. Another common program area was the general public health, which is 25% of the 2012 degrees. That's the dark red, second from the bottom. And as you can see, there's been growth in other areas as well, such as the green bar showing public health practice and program management. Now let's look at a few slides on demographics of these degree recipients. Next slide, please. So I don't think there's much of a surprise here on gender, with a higher proportion of females receiving undergraduate public health degrees. This proportion has increased from 61% in 1992 to 78% in 2012. This increase represents a 29% increase over this time period, and that is compared to all undergraduates, which had an increase in the proportion of females earning undergraduate degrees of 6%. So once again, that's a big difference, 29% for public health versus 6% for all undergrad recipients. This is similar to what we find at the graduate level data. Next slide, please. In terms of race ethnicity, the data are from 2003 to 2012. And these data show that undergrad public health recipients are more diverse than overall undergraduate population. There is a comparison chart in the article if you want to see the direct comparison between public health and the overall population. Some groups showing increases are the Asian or Pacific Islander, that's noted in green, increasing from 5 to 12%, and the Hispanic population in purple, growing from 6 to 9% over this time period. Groups showing decreases are the non-Hispanic white population in blue at the bottom, from 62 to 53, and non-Hispanic black, which is in red, going from 23 to 18%. Now, one possible confounding factor here is the sliver of orange up in the upper right-hand corner, and this represents recipients who are reporting 2 or more races. This category was introduced in 2009 and has been increasing ever since, and could be affecting some of those decreases in other areas. The next couple of slides will focus on the institutions offering these undergraduate public health degrees. Next slide, please. First, we're going to look at the public health accreditation, and here we're talking about accreditation by the Council on Education for Public Health, also known as CEPH. So this slide is a comparison between the CEPH accreditation status of the institution, that's the bar on the left, and the number of undergraduate public health degrees awarded in 2012 for each of these groups on the right. So in green, we have 13% of the overall 176 institutions that have undergraduate CEPH accreditation. And these institutions graduated 25% of the students in 2012. In blue, these institutions have graduate level CEPH education, but no undergraduate education by accreditation by CEPH. And these institutions graduated 18% of the students in 2012. Moving down, we see the red. These are the institutions that do not have any graduate level or undergraduate level CEPH accreditation. And these institutions, 127 of them, awarded 57% of the degrees in 2012. So in looking a little bit closer at the data, we note that 83 of these 127 institutions graduated less than 24 students. So many of them could be small programs, they could be new programs, they could be building programs. The data over the next couple of years will show us. So let's look a little bit more at these institutions by class size. Next slide, please. So this slide shows the number of institutions by class size. So in 1992, there were 45 institutions offering an undergraduate public health degree, and this increased to 176 in 2012. Overall, over this time period, it was an average of 37 degrees per institution, so the median was 19. And interesting that the max, well, we say there's a group of over 200, the max was 341 graduates in one year. So 16 institutions 16 institutions at the top, in the blue and the light orange, graduate the most of the students. They conferred 35% of the graduates. So these are the larger institutions graduating over 100 students. Now 56 institutions at the bottom in the darker blue that graduate less than 10 degrees account for only 4% of the graduates in 2012. So this indicates a concentration of graduates in larger undergraduate public health programs. Another interesting way to look at the institutions providing undergraduate public health programs is by year of first degree awarded. Next slide, please. So this pie chart shows the proportion of 2012 undergrad public health degrees awarded by first year that the institution awarded their first degree in public health. The data is broken up in 5-year increments and also indicates those before 1993. So we see here that over half of all 2012 degrees are from institutions that awarded their first degree between 2003 to 2012. The light blue and purple pie chart pieces on the left. Of also note of interest is for the institutions that have been around the longest, since before 1993, and they awarded 26% of 2012 degrees. So this chart shows significant growth in number of institutions conferring undergraduate public health degrees. Next slide, please. So one last slide on the institutions is this map showing the location of the institutions offering undergraduate public health programs. The circle sizes represent the 2012 class size. The majority of programs are on the coast, which somewhat mirrors the location of universities in the U.S. and the population in general. The institutions offering undergraduate public health in the middle, though, are increasing in both number and size. Some of the top geographic locations by state are California with 11 institutions, graduating 12% of the 2012 graduates. North Carolina at 11 institutions, and Florida at 6 institutions, graduate 8% each. In Oregon with 4 institutions, and New York State with 8 institutions, graduate 6% each. Also of interest in terms of institutional makeup is what type of institution is offering these undergraduate public health programs. 75% of undergrad public health programs are from public institutions, 18% from private not-for-profit, and 6% are from private for-profit. I want to point out there are additional statistics on institutional characteristics, such as whether there's a doctoral degree or the size of the institution, and whether it's rural or urban, and you can find those in the article. And we continue to do research on the characterization of these institutions, so hopefully that will be forthcoming in the future. The next slide offers some questions that were raised from this research and what information we were able to identify to begin answering them. We also include some information about what steps might be needed to answer them. So first, foremost, one question on everybody's mind, can we trust this data from the National Center for Education Statistics? While nearly all institutions report data, as JP stated, the data is only as good as reported, so quality in, quality out, or vice versa. The quality of these estimates depend on the university registrars and data analysts that input the data for the entire university. So, of course, misclassification may occur, and we consider that this may be happening specifically for smaller programs, those that were under 10, that reported under 10 graduates. So we did a sensitivity test and removed all those institutions that had less than 10 graduates. So the number of institutions went down by 1/3, so the total graduates only went down by 4%. So this suggests that the number of institutions may be less than what we are getting here from the National Center for Education Statistics data, but the number of undergraduates there seems to be pretty consistent. Another, of course, trust problem with the NCES data is the definition of public health, and whether the definition of public health is consistent across the institutions that are reporting, and how NCES defines public health. As JP noted, we did include a few other areas of studies, such as epidemiology, that weren't directly under the public health CIP code. In addition, areas such as nutrition and exercise science, which are very popular, they could be coded as public health if they're not coded directly under each of those categories. In addition, some other items that are public health may be classified under a different NCES code, especially if the program of public health falls under a different college that lump sums their reporting by that college. Some more research is definitely needed to build our trust or figure out how to work with this data the best that we can. And ASPPH is doing some research in that area We do collect a lot of data from our members and have for many years, and we are doing a comparison between our annual data collection on public health and what gets reported to NCES. And our goal here is to inform our members and to improve the reporting if it needs to be improved for any of our member institutions. Next slide, please. Oh, can you go back a slide, please? Yeah. So one question, another question that's been raised by this article was, will demand for undergraduate public health degrees continue to grow? Well, as you've seen at the hot off of the press slide, there's definitely an upward trend in graduates in a number of institutions. So it seems like the demand is still there from the students. It's difficult to compare public health data with other areas of study just to predict where public health is going, where this demand is going to be leveling off. And the problem comes, as I think Craig stated, public health started as a graduate degree and is now booming on the undergraduate level. Most other areas of study, there are more graduate students than undergraduates. So in the article, we show that the comparisons of the ratio of undergrad to graduate students for public health is the inverse. We show that there's, in 2008, there were 1 undergraduate public health degree for every 3 graduate degrees. And then shifting down into 2012, that went from 1 undergrad to 2 graduate degrees. So there may be potential for undergrads to outnumber graduate students in public health. We do have been looking at the data from the graduate level at NCES data, and there is definitely an upward trend in graduate level public health as well. Another is the demand increasing. Or will continue to grow. There are a number of institutions, schools and programs of public health that have established capacity at the graduate level, and they may be, that capacity may be transferred to easily build up an undergraduate public health program. And if Craig is still on, he can comment on that for the University of Louisville at the end of our presentation. Lastly, CEPH is now offering standalone baccalaureate accreditation, which could have an effect on this demand as well. While the supply of students is certainly there, and public health is one of the fastest growing areas of study, how fast is it growing? Next slide, please. So this table shows the fastest growing mid-sized undergraduate programs in the U.S. And the data are from 2008 to 2012. It shows the percent change in the rank. So as you can see, public health is the 10th most fastest growing undergraduate program. If you look at a lot of the other categories here, though, these are the CIP codes from NCES. A number of them are also in health-related fields. The N here is 157, by the way, so we're 10th out of 157 as far as fastest growing areas. So this really is a supply and demand issue, of course. So if we have a supply of graduates, what will the demand from the workforce be? And such as, will the soon-to-retire government and public health workers open up more opportunities? Will there be more opportunities in the developing world for these workers? Will other fields also recognize the benefits of having someone trained in public health on their teams? Next slide, please. So that leads us to the question of, what are the activities of these students who receive an undergraduate degree in public health? We do wonder, are these graduates going into the workforce, the public health field, or another field? Well, the data overall is limited here now. I do know some institutions are able to answer this question for their graduates. It's just not an overall answer available at this time. ASPPH did do a convenience sample survey a few years ago, and it did point to the fact that some are finding employment, some are going to advanced degree, some are volunteering, some are, of course, traveling. So really what we want to know is, if they are going into employment, where are they going? The Bureau of Labor Statistics does predict a large increase in all health fields. They don't break down public health specifically, so their data set is even more challenging than the National Center for Education Statistics. But they do predict a high increase in all health fields through 2022. And the National Association of Colleges and Employers, as well as ASPPH efforts at the graduate level, are looking at where graduates go to work immediately after they graduate. So this is another area that can be looked in more because we want to know where they're going to work. But if they're not going to work, what about looking for an advanced degree? Next slide, please. One hypothesis is that these public health graduates are being seen as a new pre-med that are going into medical school. So this slide shows data from the Association of American Medical Colleges applicant file. And on the left, and in blue, is the number of undergraduate public health degrees. And on the right, in green, is the number of applicants to medical school with an undergraduate public health degree. So you can see they both have an upward trend, though that number on the right is relatively low compared to the number of applicants overall for medical school. Another hypothesis is that these graduates go on to graduate school in public health. So we looked at data from SOPHIS, the Centralized Application Service for Public Health, which shows that fewer than 6% of U.S. citizens with an undergrad degree in public health apply to graduate programs in public health through SOPHIS. So it just still begs the question, where do they go? I think this is the next big question to answer. Next slide, please. But apart from all that, is this a growth opportunity for the field of public health? These graduates could be an important potential source of workers for the governmental public health. Of course, that depends on availability of positions and also the promotion of these positions to these graduates. There are some programs out there. I know one with CDC and probably others at the local level. The Public Health WINS data recently provided some important stats on the governmental public health workforce, and JP on the phone today was a part of that study, and we'll ask him to weigh in on, during the questions and answer session, his insights from this study as well as the Public Health WINS. Next slide, please. So this concludes the presentation part of our program today. I want to mention some resources available. Through ASPPH, we have an interactive dashboard available on our website. The link is right there. And this is one we've had up there since the paper was out, but we just today added in the 2014 data. So if you are interested in interacting with the data and exploring the data more, I encourage you to go to that website. Another resource from ASPPH is the Undergraduate Education for Public Health Summit. This will be March 20th, 2016 in DC, and abstracts for that are due October 21st, sorry, in 2015. And lastly, if you want to receive updates from ASPPH, you can do so by providing us your information, and we'll add you to the list. Next slide, please. Some other resources from our partners here, the Beaumont Foundation. You can visit their website to learn about their work in the undergraduate public health, as well as the work in governmental public health overall. And the article, of course, is available on Public Health Reports. Next slide, please. So if you didn't get all those links, the presentation will be available after we finish here. And now I believe it's time for questions. I will hand the controls back over to Erin.
Thank you to all of our distinguished speakers, Dr. Craig Blakely, Dr. J.P. Leider, and Ms. Christine Tepes. We will now take questions from the audience. Several of you have already submitted some questions, but for those of you who haven't, if you're interested, you may type your question for any of the authors into the chat or question box in the right-hand corner of the screen. You can open that box by pressing the 2 arrows. So without further ado, our first question. This one was posed specifically to Dr. Leider. As stated, it seems that these graduates may be poised for the governmental public workforce. Would you please expand on what the Public Health WINS survey showed for the makeup of the governmental public health workforce, and how many of them have degrees in public health, undergrad or otherwise? Dr. Leider?
Great, thank you. Yes, so for those of you unfamiliar with WINS, late last year, the Beaumont Foundation and the Association of State and Territorial Health Officials, ASTO, conducted a large-scale survey of public health workers, specifically those at the state health agency central office level. And so we got a nationally representative sample, about a little over 10,000 respondents in that frame. And what we found is that approximately 17% of the workforce has formal training in public health of one sort or another. Most of that training is in master's level, typically MPH was the most common, and undergraduate public health was relatively less common, below 5% generally speaking, especially for those who were older in the workforce. Those who are younger in the workforce slightly more had undergraduate training in public health, but we're really not yet seeing a lot of folks come into the system being perhaps younger and having had that kind of background. I do think there's an open question, though, and this is something ASPPH and their members have started to tackle, which is what really will delineate bachelor's level folks from master's level folks from the point of view of inputs into the workforce. And I think that's an open question. I imagine much more research will be needed, but the supply is definitely there, both from the graduate and undergraduate side, so it's very interesting to get a better sense of the demand as well.
Thank you, Dr. Leider. We are getting a lot of questions, so if we do not have time to get to all the questions, we will make sure that there's a Q&A FAQ posted along with the webinar online. Next question posed to the panel: what reasons are universities continuing to bring on new undergraduate public health programs?
So I'm still here. This is Craig. I'll
okay.
Go ahead and jump in on that one. I've got about 7 more minutes. So,
okay.
So that's an interesting question, and we in academia are always pushing to be efficient about the programs that we have in place, particularly given the tendency for fiscal resources to be less plentiful than they used to be in the past. And so, when you pay attention to kind of job opportunities out there, it's really a workforce demand issue. From public health departments to private and nonprofit entities, there's a growing demand for public health trained professionals at the undergraduate level. Part of that being simply an economic issue. But we've also been approached about developing specific tailored or directed MPH programs. I'll give you one illustration. Petrochemicals industry has historically done safety work by taking 50-year-old chem engineers past their prime in their chosen field and pushing them into being the safety officers. And if you follow all of the problems that we have in petrochemical plants with explosions and things like that, there's some sense that doesn't really work too well. And so they started hiring master's level public health folks who are trained in the safety area, and discovered that that's a better way to go. And then in order to expand the numbers, there was an interest in building an undergraduate curriculum, particularly or specifically tailored to that kind of a thing. So there are both tailored reasons and then just sort of generic pressure to build a workforce at the undergraduate level, which kind of fits from the backwards way we started the profession by coming out of medicine and only building doctoral programs and master's programs in the first place. So I think there's pressure from private sector, and if we're not looking out for making sure that students have access to jobs, then we're missing part of the point here. So I think it fits really naturally that way.
Great, thank you. Another question, this one is posed to Ms. Puppies. I've seen other reports that the state of growth is not as high. How do you react to that statement?
Yeah, there are different methodologies out there, and it's just, there's no clear way forward with the definition of what is public health. And as we showed in our article, we questioned that too. And so that's one of the things we did was remove some of those institutions that were reporting less than 10 degrees, like, is that for real or not? And when we did that, it definitely lowered the number of institutions that were offering undergraduate public health. So, you know, each data source is as good as its quality in, quality out, and you know, I think all this information is just informing the field through this article and through others that are working on this.
Okay, great. Here's a question posed to the panel in general. Is there data regarding which degrees were awarded, a BA, a BS, etc.?
Not particularly. We'll know kind of basically what level a degree will come in at, so NCES tracks associates, bachelors, different kinds of masters, different kinds of doctoral. But at the bachelor's level, there's really not too much delineation going on just yet.
And this is Christine. I'll jump in here too. Based on the ASPPH annual data collection that we do, we are collecting data from undergrad programs that are our members, and we do delineate between BA, DS, BSPH, BAPH, other bachelors. So we are collecting some data. It's not full reporting. Undergrad has some issues as far as getting that information. What defines an undergraduate student is always complicated. Whether they become a public health student in their undergraduate program, sometimes it's complicated. And so we're just new to this, collecting this information, but we are honing in on that, and we do collect it by those different categories.
Okay, great. Here's a question posed to the panel. Is the proportion of public, private, or for-profit schools that house the undergraduate programs similar to the proportion of public, private, or for-profit institutions in the country at large? Is it something that you're recognizing that's balanced between the public, private, and for-profit?
That's a good question. I don't know. Have we looked at that, JP?
Yeah, we have. So I think it's in a forthcoming report. So generally speaking, it is somewhat similar. I will say at the graduate level, there's a little bit more impact from the, let me make sure I get this right, the proportion of graduate students who come from private, not-for-profit institutions is a bit higher, in part because of just the history of public health. We have a lot of older schools, some of which, especially Hopkins notably, that put out a lot of students each year, graduate a lot of students, and account for a larger proportion are private. There are a small number of growing for-profits at the graduate and undergraduate level, but it's not a huge proportion just yet, although it's been growing in these past few years.
Okay, great. A question kind of that goes along with the types of schools. Is there data on what percentage of the CEF accredited schools of public health offer an undergraduate major?
We do have that. In that one slide, it showed, I can't remember the number, I think it was 15% offer. This is 2012 data, where the school or program is accredited by CEPH and has an undergraduate program connected with that school or program. So it is in the slides, a few slides back.
Yeah,
okay.
One thing I will mention, though, this is JP, that right around the time when we were publishing this, the CEPH released their standalone baccalaureate accreditation standards. And so you might view this study as kind of a baseline from which you'll be able to compare changes over time to who's coming from accredited institutions. Because a lot of the institutions we looked at who are graduating these students are coming from programs that don't necessarily have an affiliation with a graduate level school or program of public health, which I think we were initially surprised to find. But when you kind of look at the genesis of these programs over time, I think it makes a bit more sense. And so I think in the future we're going to see a lot more students coming out of schools and programs at the undergraduate level who have accreditation from CEPH.
Okay, great, thank you. Here's a question specific about the surge of public health majors in 2004. Do you have any kind of speculation on why that might have happened?
I think we had thought about
so.
whether...
We've been thinking about that. Go ahead, Christine.
sounds right. We both JP and I have been thinking about it and talking about it at the same time. So we had a couple of ideas just thrown out there. Is it the new generation? Are they more? They're looking for degrees that are doing good for the world, and was one of our theories. Also, after post-September 11th, was that something that drew more people to study public health, population health type of studies and take those up? So I don't know, JP, anything else to add to that?
Yeah, I think one of the other ideas that we've talked about over time is that if folks are graduating and starting to graduate a lot more in 04, that's in part because of program availability, of course, but also that a lot of these students started right around the turn of the millennium. So really what happened in 2000 or 2001 that changed things for these institutions and these students, it's still tough to say. It's something we're still looking at. The other thing that I might point out is that if you look at the change between the growth in liberal arts degrees versus the sciences, public health sort of sits in the middle. So although psychology, sociology, political science continue to be some of the most popular degrees, their growth has slowed tremendously over the past few years. So I think one idea that we've had that we're trying to figure out how to really examine is if this is more of a health or science-oriented version of like a political science degree. People who are interested in political science, perhaps they were looking at this degree and that could account for some of it. But the other thing that Christine and I have talked about over the last couple of years about this is that if you look at the field of health and health-related degrees more broadly, that they're growing tremendously. So that slide we showed you, I imagine most of you noticed that a bunch of those degrees in the top 10 came from a health-related field, and so it may be that it's different parts of the same family are growing quite substantially.
Great, thank you. We have a lot of questions on post-graduation data. What type of analysis has been done or is being done on, for example, how many public health undergrad students apply to graduate programs? You know, what kind of differential is there in the marketplace between an undergrad or a graduate student, that kind of thing. Can you elaborate on other data that's being done or analysis that's being done that would kind of focus on that bigger picture?
Yeah, that is definitely the big question out there. Where do they go? What are they doing? And we do not have, ASPPH does not have or is aware of a solid resource that provides an overall picture. We've done a few studies here and there. We're also working now to collect postgraduate employment and activities from not only undergrads but also our graduate level students. So this is something new and that we've been working on. It's a challenge. Everybody's working on it. So I don't have good answers for that at this time. Some of the slides did, you know, we had hypotheses. Are they going to medical school? Are they going to further graduate school? And nothing seems to be coalescing around a solid answer to that question at this point.
Okay, thank you very much. Can you discuss the accreditation standards for these undergraduate programs? It's been stated that these undergraduate degrees are coming from accredited universities, but maybe not all the degrees themselves are being accredited. Can you discuss the type of undergraduate degrees from the accreditation standpoint?
Sure.
Well, there's yeah, go ahead, Jacob.
Go ahead, Christine.
No, you first. Okay.
So it's an excellent question, and the answer is going to be perhaps more nuanced than we might like for a webinar. So I'll leave it to Christine to kind of explain the exact relationship between schools and programs and how their accreditation statuses can affect the undergraduate degree program. But I will say that it is possible in some small number of the cases that we showed you today where you would have a school or program that has an umbrella accreditation for their whole school, I should say, the institution, but for some reason the public health is separate. We think that's a pretty small number of cases, and moving forward, those institutions may well be seeking the standalone baccalaureate accreditation, even though their graduate brothers and sisters have that form of accreditation. I don't know that it would dramatically affect the proportions that we showed you today, but Christina, I'm not sure what your take is on that.
Yeah, so if the school or program of public health has CEPH accreditation and they have an undergraduate program within that school or program, then that undergraduate program is accredited. So like JP said, if an undergraduate public health program, let's say, is in the College of Education, then it would not show up as CEPH accredited with the school or program. So it actually has to be under that school or program within that college. That's how the accreditation works at the school or program level. So it will be interesting in the coming years how these standalone programs develop with their CEPH accreditation. I think a few of them are in line already for seeking accreditation.
Great, thank you very much. This is a question that might require just some speculation on your part. Do you think that the MPH programs will be changing their curriculum to meet the more advanced or the more educated, the more well-versed undergrad public health graduates that are coming through? Is this going to impact, or do you see this impacting the types of MPH programs that are offered?
Yeah, so this is something that ASPPH is looking at currently. We have our education committee looking at how this is going to work, and how, you know, every school or program is different, and how it's going to span the, you know, the makeup of from doing something to doing nothing for these students. It's going to, you know, it just really depends on each institution and what they're going to do. But it is a question out there, and I think it's been a question out there for a number of years. So, like I said, one thing ASPPH is doing is starting to look at that through our education committee.
Okay. Thank you very much. And along those same types of line, again, this is, I think, speculation on your parts, but do you see that the undergraduate degree would then start to impact the degrees held from those with a master's degree in public health? Meaning, would it be something that would start taking away the opportunities from the masters, or do you think that those with the master's degrees would still, you know, have much more of a stronghold over those with just the undergraduate degree? Do you see the correlation between those two?
Yeah, another good question without an answer at this point. Unfortunately, I think it really is going to depend on the field and what they're going to be wanting and seeking, and you know, the undergrads are still new. What are they capable of versus what are the masters, what are the doctoral students, graduates all capable of, and of course every individual is different. So this is kind of a wait and see at this point. I'm not aware of any data to support a direction on this yet. Are you, JP?
I'm not.
Okay, great. Is there data available to the general population for folks to kind of get in and see this raw data, to see the different categories that you have, to be able to see the different institutions? What type of information is going to be available to those interested in kind of getting into this and taking a look at what you've been analyzing?
Great, I'll take that one definitely, and thanks for asking, whoever asked it, because this is what we have. This is publicly available data. It is a kind of a bear of a data set to handle it, but JP has taken that on for us. And with that, we at ASPPH have put up an interactive dashboard on our ASPPH Data Center, and with that is a storyboard, and you can see this very slide that we had in here that showed the different program areas. You can see that one, and you can filter it however you'd like. We do have one of the pages in the storyboard that talks specifically about the different institutions. So you can look at the institution and the number of graduates reported in undergraduate public health. So it is a publicly available data set. We've done the work for you to get it, or JP has done the work for you to get it into this this type of format to be able to manipulate it. So I encourage you all to go onto that website and start exploring the data yourself.
Great.
Yeah, and one of the things.
Go ahead.
Thanks. One of the things that I think folks might like to do, especially if you're at an institution, is look at the numbers that you're seeing from your own programs or perhaps from your peers if you're familiar. We have seen a few cases where the numbers appear off for some reason. In some cases, we've heard that the registrar has been counting it under a different estimate, or I'm sorry, a different CIP code, or that the full year hasn't been reported. We've heard in a case or two. And so I think that that's another use, and making these data better over time by getting institutions to report quality data to NCS is absolutely one of the things we hope to achieve with that interactive platform that Christine mentioned. So have at it.
Wonderful. Here's a question on the data and the breadth of the data that was researched. Was there any looking into the AAMC data, such as medical school applicants having a degree in public health, or any other equivalent data on applicants, in other professions such as pharmacy or nursing or dentistry? Was any of that researched or analyzed, or is any of that information even available?
Yeah, I'll take that one. So when we first saw the sheer number of students coming out with these degrees from the data, we tried to get a sense of where they could be going, as Christine mentioned. And so earlier in the presentation, Christine did show a slide that showed the relative growth in applicants to medical schools who had an undergraduate background in public health. And that grew with public health, but the proportion is very small, less than 5%. And as Christine mentioned, applications to SOPHIS, the centralized platform by which people apply to public health school, also does track that information. It's also a pretty small proportion. I will say those are really the only two systems where we could get reliable estimates. The association, the AMC equivalents to nursing and pharmacy, et cetera, don't really track things in quite the same way for undergraduate backgrounds in public health. Those tend to be grouped into something else or not tracked at all.
Okay, great. Here's a question that I don't think has been discussed today. Is there any information on the rate of public health study abroad? Studies that are being done internationally?
I'm not aware of any. There may be, but we don't. ASPPH doesn't have that data.
Okay, great. Another question is, do you know, or are you aware of, are the undergrad public health programs being housed in typically a College of Art and Sciences versus the pre-professional schools, or is there a trend where these undergrad public health programs are being offered and housed?
That is something we are looking at right now. So it runs the gamut for those ones that are not housed in a school or program specifically of public health. So we've definitely seen them in College of Allied Health, College of Arts and Sciences, College of Education. So stay tuned because we are looking at that right now.
Okay, great. Let's see here. We're getting a lot of the same type of questions. Do we know how many schools and programs in public health use SOPHAs when collecting this data? And if you could maybe elaborate on what the SOPHAs is, in case for those folks who don't know what that is.
SOPHAs is the Centralized Application Service for Public Health. It's run by ASPPH, and we have upwards of, 80, 90 members who use SOPHAs now. I forgot the exact number. So those, and once again, these are for our members for applicants to apply to them through SOPHAs. And so that data set is, of course, limited just to SOPHAs participants. I know there was a question earlier asking about where these students go to study, and are they going to study public health, and the one, or graduate level public health. And we've looked at that data for SOPHAs from the last couple of years, and it was a little bit less than 6% of applicants through SOPHAs come with an undergraduate degree in public health specifically. So that's been pretty consistent over the last couple of years. That's just another data resource that we are continuing to tap into to look at the applicants to public health and see what kind of backgrounds they're coming from and what their interests are in studying.
Wonderful. Thank you. We're running out of time. I didn't know if you, Ms. Pleppies or Dr. Leider, if you had any kind of closing thoughts or statements based on what's been discussed, the type of questions that's been asked, or any kind of recommendations for the audience, for further information.
I'm really pleased that we've been able to participate with you all today, and some of the questions that were posed are definitely the questions we've been hearing, and I think when you hear these questions often enough, it's finally somebody takes the bull by the horn to start answering them, and so that's a hope to that a few years ago everybody was like, is public health growing at the undergraduate level, and we didn't know, and so this paper here was one answer to that question. So in the future, we hope to take on some of these other questions with some of our other colleagues out there in the field to find answers to them. So I encourage you once again to go onto our website, interact with the data there. We also have a data request button. If you're interested in other data from ASPPH, you can submit a data request through there. So we look forward to continuing this conversation with you. And JP, anything from you?
Sure. So one of the things that we mentioned earlier is that relative to the number of graduates we see each year in public health, undergraduates are growing but are still much less, which is quite different in some of the peer programs within the health sector that we see out of the NCS data. So there's clearly a lot of room and capacity for undergraduate public health to grow. As in most of these other degree programs, you see more folks, many more folks at the undergraduate level getting degrees than at the graduate level. The question is going to be over these next couple of years, where do they go? What will the value of the bachelor's degree be compared to other types of degrees we're seeing come out of schools and programs of public health? And how does that interact with both the private and public sector? So I'd say think about this as one of those baseline or foundational studies, and keep track of it over time. I think there's a lot of room to grow, and we'll see how that happens. Thanks everybody for your time. We hope you liked the presentation and the paper, and look forward to talking with you all more about it in the future.
Wonderful. Thank you so much. I'm afraid that's all the time we have for questions today. If we could go to the next slide, please. See here. For those who are interested in seeking a certification in public health continuing education credit, you may do so on the CPH website. The password that you will enter in to seek credit is called Undergrad, UNDERGRAD. I want to thank you for joining us today, and a special thank you to the speakers and their staff for their time and contributions to this very important public health topic. I also want to thank the Association of Schools and Programs of Public Health and the Office of the Surgeon General for their continuous support. Next slide, please. Thank you again for participating. This is the end of the Public Health Reports Meet the Author webinar. As a reminder, this webinar will be archived on the PHR website at publichealthreports.org for future viewing. We will also post the actual slides used today. And if you are interested in any follow-up questions or discussions, please feel free to reach out to any of our three speakers today. Ms. Christine Pleppies is our data manager at the Association of Schools and Programs of Public Health, and she is a wealth of information if you are interested in discussing any of this in further detail. So thank you very much. Have a great day, and we look forward to seeing you next time. Bye-bye.